Hello, I'm Richard Kainer, Director of Treatment and founder of Brooklyn Audiology Associates.
And I'm Dr. Max Rubin, audiologist and co-owner. Welcome to Brooklyn Audiology Associates. Please watch the following video message from our colleague, Dr. Keith Darrow.
Stay tuned through to the end for an important message from us and how to get a free copy of my co-authored book.
Hi, I'm Dr. Darrow, Harvard Medical School and MIT-trained neuroscientist, and I'm here today to give you my short presentation on the healthy brain. We will cover everything you need to know about the medical treatment of hearing loss, tinnitus, and associated cognitive needs. All right, let's jump right in. If I asked you, what do you think the number one cause of hearing loss is? What would you say? You know, a lot of people say noise. All that loud noise, those loud concerts. Well, truth is, the number one cause is aging. Look, it's a fact of life. As we get older, our senses begin to diminish. So our ability to see, our ability to hear get a little bit worse. So I want to talk you through the changes that actually happen in the hearing system so that you can better understand what's actually happening in your ears, what's actually happening in your brain. And then I'm going to talk to you about the consequences if we leave hearing loss and tinnitus untreated. Okay, so what you're seeing here is what we'll call the normal ear-to-brain connections, okay? On one side of the screen, you see the ear, okay? It almost looks like a snail. And on the other side, you see the big, healthy brain. And in the middle, there are a number of arrows, these big bright arrows, and what that represents is the millions of neural connections from ear to brain, okay? Now I want you to look at this, study this for a second. This is what the normal system looks like. There's a very vibrant, there's a very plentiful number of connections from ear to brain. Now go ahead and keep watching, because what I want to show you is what happens to that ear to brain connection as we age. It's pretty shocking, right? All right, I'm going to go back. I want you to see this in real time here. This is the normal ear to brain connections. This is what happens as we get older. So let's go ahead and define what actually changes. So two things. Number one, there is quantifiably, there are less neurons connecting the ear to brain. Now look, truth is, when you lose a nerve, you can't get it back. All right? But what's more important here is that some of the nerves that remain, their quality is less. They're not as bright. They're not as vibrant. That is hearing loss. And there's a simple phrase that goes with this. Use it or lose it. If you don't keep those remaining connections stimulated and keep them active and give them all the sound they need, they too will die off. Which is why hearing loss is technically defined as a progressive degenerative disorder. Once it starts, the goal of treatment is to slow it down. And without treatment, it will get worse faster. More nerves will die off at a quicker rate. And so let's learn a little bit about the consequences. So as these nerves die off, if we don't treat them, here are the three things that patients experience, okay? Here are the three things that result from untreated hearing loss. Consider them the neural consequences of hearing loss. Number one of the most common symptoms that our patients talk about is tinnitus. Tinnitus or tinnitus, doesn't matter which way you say it, either way is right. When this happens, there's that annoying sound, the ringing, buzzing, swishing, swooshing in the brain that, for most people, it doesn't go away. I want to try to explain tinnitus at a deeper level for you so that you understand why you have the ringing, okay? Perhaps you've heard of phantom limb or phantom limb pain. See, what happens in that situation and why tinnitus is very similar is that if you were to lose an arm or to lose a leg, most of those patients will tell you that they can still feel that extremity, right? Because the brain makes up for the missing signal. The same thing happens with tinnitus. In fact, The textbook definition of tinnitus is a phantom sound heard in the ears or the head. It's not a coincidence that they both use the word phantom, okay? It's the false perception of sound. Now, what's actually happening is as those nerves die off, remember that picture I showed you where the nerves are dying off? The brain will go searching for the signal that used to be there, and now your brain will falsely hear ringing, buzzing, swishing. Look, every patient has a different experience with their tinnitus because every patient's hearing loss is a little bit different. All right, let's move on to the second consequence of untreated hearing loss. Here it is, auditory deprivation, which is really just a fancy way of saying the brain is not getting all of the information that it needs, okay? Which means it's going to be more difficult to hear your spouse if they don't speak as loudly and as clearly. It's going to be more difficult to hear in background noise. I bet you've experienced that, right? And so with hearing loss, I would say probably the second most common complaint right after tinnitus is I can't hear at restaurants. I used to be able to go to this certain restaurant and I would have a great time, but now it's more difficult. Look, if you want to hear in background noise, your ear to brain connections have to be working on all cylinders. And as soon as that starts to break down, even at the earliest stages, it gets really difficult to hear in background noise. Okay, moving on to number 3. Hearing loss can result in cognitive decline, all right? There is a strong correlation that shows hearing loss is linked to increased risk of cognitive decline and dementia. And I'll come back to that in a second. But I want you to know what it looks like for the patient at first. In the beginning, it starts out as something simple. You have difficulty naming things, perhaps difficulty remembering what you had for dinner last night or what you did a few days ago. And then the memory issues become more of an impact on daily life. And this can be the result of not having proper sound stimulation from your ears all the way up to your brain. So let's talk a little bit more about these connections. So about 10 years ago, a paper came out of Johns Hopkins that showed us, first time it was reported, showed us that hearing loss is strongly correlated with increased risk of dementia. I want to go ahead. So on your screen, you can see some of the clippings of the different journal articles. I would say to date, there's probably 25 to 30 articles that have backed up this data and showed this strong correlation. But here's a summary of all the data that's out there. Go ahead and look at this. Untreated hearing loss increases the risk of dementia by 200 to 500%. Take that in. I'm going to say it again. Untreated hearing loss increases the risk of cognitive decline and dementia by as much as 200 to 500%. That number is astronomical. Now, the dependence is based on the degree of hearing loss. And so for those of you out there who think, yeah, I have some hearing loss, but it's not a big deal, guess what? That mild hearing loss, it's a major problem because even a mild hearing loss can increase your risk of cognitive decline and dementia by as much as 200%. All right, let's talk about how these are connected. Why is it that hearing loss can lead to cognitive decline and dementia? All right, first let's back up though. I want to first talk about what is dementia, right? There's not a great understanding. We all know that it impacts memory, but I want to dive a little bit deeper. And I was reading a book once and I read a quote, really powerful quote, and I'm going to share it with you. Everyone knows someone who is a cancer survivor, but no one knows an Alzheimer's survivor. This was by Dr. Bredesen. Dr. Bredesen has this quote in one of his books. It's a very powerful statement. At this time, there is very little that can be done once diagnosed with dementia and Alzheimer's. So the key really is prevention. Now, what is dementia? We know that it's a decline in mental ability that's severe enough to get in the way of everyday life. Now, each of us has these 5 core cognitive abilities, all right? We're talking about memory, communication and language, ability to focus and pay attention, reasoning and judgment, visual perception. The way you can get yourself the diagnosis of dementia is to have difficulty in 2 of these core cognitive competencies, all right? Now, let's talk about each one. Memory. Guess what? If you don't have great hearing, you can't remember everything that's said to you. So hearing and memory are intimately tied with each other. Communication and language. All right, here's what we know. 50% of the communication equation is hearing. 50% is speaking, okay? So you need hearing to best communicate with your loved ones and people in your community. All right, ability to focus and pay attention. Remember earlier we talked about difficulty in background noise? Well, that difficulty can really wear down the brain as it gets really hard to focus and pay attention. Thus, hearing loss can be linked to increasing the risk of cognitive decline and dementia. And then there's reasoning and judgment, visual perception. Hey, for those of you that didn't know, if you leave your visual impairment untreated, that also increases your risk of cognitive decline and dementia. So yeah, we better take care of ourselves as we age. Now, the word dementia is typically this umbrella term. Now, they consider it an umbrella because it's defined as a decline in mental ability, but under the umbrella, there are different types of dementia. About 2/3 of cases of dementia are of the Alzheimer's type. About 20% are the vascular dementia, and then there's other forms of dementia, Parkinson's-related, Lewy body, frontotemporal, and more. Those are the more rare cases, but they are real and they are devastating to families. So let's go back to, I want to talk about the 3 things, the 3 theories of how hearing loss is linked to cognitive decline and dementia. Number 1, social isolation. For as long as I can remember, for all the annals of research that I've become familiar with, there have always been reports about hearing loss increasing social isolation. That's why I named the book, Stop Living in Isolation. But we also know that for those people that go without treating hearing loss and tinnitus, they also do less physically. Now look, it doesn't take a medical degree to know that if we don't interact with others and we don't regularly exercise, that's not good for your body or for your brain. All right, number 2, we now understand that hearing loss is linked to cerebral atrophy, which is really the fancy way of saying your brain can shrink. Okay, so in a study that came out several years ago, they showed a really strong correlation of hearing loss and brain shrinkage. Now, I want to show you a picture. You know, a lot of people say a picture says 1,000 words. Look at this picture on the screen, okay? On one side, you see a brain with hearing loss. 68-year-old, I believe it was a female, with hearing loss. On the other side, you see a normal, healthy brain of an older adult who does not have hearing loss. I'm pretty sure you would agree. The differences are striking. The data tells us that there's as much of a 40% reduction in the brain volume, which means there's less neurons in the memory, speech, language, and hearing parts of the brain, which then extend far beyond those parts and lead to more global cerebral atrophy. So hearing loss can not only affect us socially, we want to do less with others, but it's having a real impact on our brain. All right, number 3, this fancy thing called cognitive overload, okay? In my science circles, we talk about cognitive overload, which basically means you're taxing the brain. What I show you here on the screen is a recent peer-reviewed journal article that essentially showed people with hearing loss work much harder to hear when there's background noise, which is why so many people complain about it. You might think, well, that's not a big deal. It's annoying, It's frustrating. It's embarrassing. I'm here to tell you it's a big deal because you're taxing the brain. Here's my simple analogy. Living with untreated hearing loss is like driving your car 60 miles an hour in second gear. Yeah, that kind of really brings it home, right? And what would happen to your car if you only drove around in second gear, right? You're not giving the brain everything it needs when there's hearing loss and tinnitus. I want to show you a little example, right? Now, this is a visual sample here. I know we're talking about hearing, but I want to give you a visual sample. This is what it's like to have hearing loss and background noise, all right? Go ahead and try to read this sentence. Now, you may be able to fill in the gaps. You might be able to say, well, I think it says, Dear Karen. Like, I know some letters are missing. Look, that delay, that 1, 2, 3 second delay in you figuring this out is what it's like hearing in background noise, is what it's like trying to keep up when you're at a noisy restaurant and the conversation is passing you by. By the way, if you're wondering, it says, Dear Karen, how's everything? Will you meet me tomorrow at McDonald's? Love, Howard, right? Notice I took out most of the consonants. If you're wondering why, hearing loss is typically a clarity issue. And we get the clarity of speech from the consonants. So words like he, she, see, t, those all start to blend together if you take away those consonants. That's what it's like living with hearing loss. Even at the earliest stage of hearing loss, you've lost the clarity. Okay. Now I want to talk about the benefits of treating hearing loss. Okay. Now that you've hopefully come to understand the significant impact that hearing loss has on you socially, emotionally, physically, and cognitively, now I want you to realize how important the benefits are. I want to talk about the 4 major benefits of treating hearing loss. Let's just dive in to each one. Number 1, improvements in quality of life. That's right. Now that one might seem obvious because you can hear better, you can interact better, and frankly, this is one of the easiest things that we do. We can restore hearing in all situations so that life is easier and less frustrating. But look, there's actual studies that show this. A National Council of Aging report found that individuals who treat their hearing loss and tinnitus report an improvement in overall quality of life, self-esteem, and relationships at home. Those are pretty important. I mean, you could stop right there. Those are enough reasons to stop trying to live with untreated hearing loss and take your first step towards getting the right treatment. Here's where clinical intervention really benefits you. Here's where clinically managing your hearing loss and tinnitus under the supervision of an audiologist or a trained hearing instrument specialist, here's where the benefits are really important. Increased cognitive function. What does that mean? We now understand that treating hearing loss helps you stay mentally sharp as you age. And there's real data for this, right? There was a paper that came out not too long ago that found that after 2 weeks of treatment, that's it, just 14 days, that there was significant improvements in selective attention, memory recall, and processing speed. Who doesn't want that? Who would argue that these are bad things? And this comes from treating your hearing loss and tinnitus as early as possible. All right, here's the third thing. By providing proper stimulation to the brain, you can reduce tinnitus. And I want to go ahead and I want to give you an example of what it sounds like, what this sound stimulation actually sounds like to your brain. Now, I'm going to play 2 different samples. The first one is what it's like to be in a crowded restaurant with all this background noise. And then the second is what it feels like or what it sounds like to be in that same restaurant when treating your hearing loss. Let's go ahead and give a listen.
Really glad we came to this restaurant. It's always been one of my favorites. The desserts here are amazing.
If I asked you to repeat everything that man said, do you think you could do it? Probably not. I think I've yet to meet a person with hearing loss who could hear everything that was being said. Now I'm going to play a sample of what it's like to hear that same environment, but now it goes through new modern treatment technology that helps you hear your best and reduce your tinnitus. Go ahead and listen.
I'm really glad we came to this restaurant. It's always been one of my favorites. The desserts here are amazing.
Yeah, I think I can see you smiling through the screen. There is such a dramatic difference. This is why we can confidently say we can restore your clarity and help you hear your best in every situation, including those really noisy restaurants. All right, finally, number 4. And this one's the most personal for me. People who treat their hearing loss reduce their risk of dementia. I lost my grandmother to dementia. Almost every family is touched by dementia. But what would it mean if you could significantly reduce your risk of dementia by doing something as simple as treating your hearing loss? Let's dive in and look at some of the data. So there's a worldwide report. It's published in The Lancet, which is one of the most famous and one of the oldest medical journals out there. And this report, which just came out in 2020, has 2 major findings. Number 1, 4 in 10 cases of dementia are considered preventable. You want me to say that again? 4 in 10 cases of dementia are considered preventable. That means if I knew then what I know now, maybe, just maybe, I could have helped my grandmother avoid that dreadful fate of dying with dementia. It was terrible to watch through. And if you've experienced it, you know what I'm talking about. Number 2, the second finding from this report was really straightforward. What they did was they actually listed in order of importance what you need to do to be in that 4 out of 10. What you need to change in your lifestyle in order to prevent dementia. And if I asked you, what do you think? What do you think is on the list? I bet most people would say, well, I should eat better. I should exercise more. I should learn more. I should stop smoking. And you'd all be right. Except what you're missing is the number 1, not number 2, not number 3. The number 1 most modifiable factor for preventing dementia is treating hearing loss. The number 1 modifiable factor, the number 1 thing that you can do in your life is treating hearing loss. Look, it's 8 times more important that you treat your hearing loss than reduce your alcohol consumption. It's 4 times more important that you treat your hearing loss than reduce your hypertension. That's how important treating your hearing loss is to avoiding cognitive decline and dementia. And finally, I want to tell you a little bit about what our treatment plan looks like. What does it all look like when we address your hearing, tinnitus, and cognitive needs? Our treatment plans are affordable, right? I love when my patients smile when I tell them, look, we will not make a hearing problem a financial problem. In fact, all of the plans we offer are compatible with insurance plans. We make sure our patients get the best treatment at the most affordable price. Included in your treatment plan is all of your technology needs, all right? We also provide full lifetime warranty. We have a satisfaction guarantee. Everything's included. And look, here are 2 facts of life when it comes to hearing. Number 1, your hearing, tinnitus, and cognitive needs will change over time. Number 2, technology will continue to improve. And so members of our treatment program, every 48 months or so, we actually go back to the drawing board, we upgrade and update the entire prescription, and you are sent on your way with the technology that's right for you. This may happen sooner, that's okay. Whatever you need, we're always there for you. So, I'm going to leave you with my simple take-home message. Aging is inevitable, but decline is optional. I think if you're watching this video, you've already made a choice about how you want to actively age. You've already made the decision that you want to stay in your home longer. You've already decided that you're going to live your best life. Thank you for your time. Thank you for your attention. And I can't wait to see you around one of our Excellence in Audiology practices. Take care.
Hi, I'm Richard Kaner, and this is Dr. Max Rubin.
Thank you very much for watching that very important message. And welcome again to Brooklyn Audiology Associates.
When I started this practice in 1980, it was founded on the core principle to treat every hearing loss, its debilitating symptoms, and the cognitive aspects associated with hearing loss to the very best of my ability. Here at Brooklyn Audiology, through over 4 decades of research and case studies, we have developed a proven process for making you hear the best you possibly can.
With the appropriate treatment, you will not only hear better, but we can help reduce your risk of the hearing loss getting worse and reduce your risk for cognitive decline. Rich and I, along with all our providers and staff, will help guide you on your journey to better hearing.
Thank you for trusting us for all your hearing healthcare needs for over 40 years.